Did you guys get my questions?
Yeah, I got
Okay.
them. All right. So first off, we just want to ask you like what your position is at the hospital, what kind of unit you're mostly in. And stuff like that.
I'm in the intensive care unit. I'm a critical care physician assistant, PA.
And how many Delta cases do you think you guys have seen in the last couple of months?
I think they're all Delta
Mm-hmm.
because that's the overwhelming strain now. So, you know, as the variant entered the country, it took over.
Yeah.
So I think everything that we're seeing now is the Delta.
Okay. And has this strain like presented any new challenges compared to the first wave of COVID?
I think we're seeing younger patients.
Yeah. And younger, like what age kind of range?
So anywhere from 18 to 40. I mean, we've seen, you know, we haven't had too many like 18-year-olds.
Mm-hmm.
We've had some, you know, pretty much mid-20s to, so if you're looking at young people, 18 was the youngest that we had. And then, so I'd say, you know, mid-30s, 40s.
Mm-hmm. And I know you said off camera that you just had a recent patient pass away
Today,
today. He was on the younger side?
he was 30.
Wow. So obviously I think you're an advocate for vaccines and
Absolutely.
mask mandates,
Yep.
things like that. Did the hospital take any specific precautions to prepare for this new variant, like once it kind of got reported?
No, we treated, you know, in our mind, COVID is COVID is COVID. So we didn't change anything that we do for the new variant. I think we know more now about how how it acts, and you know, there's no real treatment or cure for it.
Mm-hmm.
We know some of the things we've changed, like in the beginning, we intubated everybody right away.
Mm-hmm.
So if they had any respiratory distress, we intubated them. And now intubation is the last thing we want to do. We try to get them through without going on the ventilator. We still do like remdesivir and steroids. In the beginning, we never gave steroids. You know, it was like a no-no. Oh, you never want to treat with steroids. But now we know that, you know, these patients do need steroids.
Yeah.
So I'd say we're a little bit better prepared because we kind of have it down what to do now.
Yeah.
But unfortunately, for some people, it still doesn't change their outcome.
Yeah. And when we did our interview with Myrick, he said that you guys in the ICU did an incredible job, just like not only taking care of him, but like keeping his mother in the loop and
His
all
mother
that.
was a trip, yes.
Yeah.
Yeah.
Yeah, definitely got that vibe.
Yeah, so because families are not allowed in,
Mm-hmm.
in the beginning it was really hard because I would bring my own phone in and FaceTime the families.
Mm-hmm.
And sometimes, you know, as the patients were dying, I would be in there with my phone so they could watch them while they died. Yeah.
So has it been nerve-wracking for you personally seeing this and having fear of maybe bringing it home?
Absolutely.
Yeah.
In the beginning, when this really started, you know, building, I remember mornings sitting in the parking lot and crying and saying, I don't know why I'm doing this. You know, I don't want to die, and I don't want to give it to my family.
Yeah, I know my dad had a similar kind of thought process.
Yeah. And then, you know, you just kind of plug along and you do what you have to do and you put it out of your mind and you just do what has to be done.
Yeah. Yeah, all props to you medical professionals. I could never do that. So, you guys want to do a couple? I got yours on my phone.
No, I got a chance to switch it up.
Okay.
Yeah, I didn't realize it wasn't a patient anymore.
Anyone want to take the seat?
You want to go? You
No, you go first.
Okay. Hello.
Hello.
Alright, so, I'm Jai. We met earlier, but just wanted to, So, what are, the worst case you've seen so far in your opinion?
The worst case that I've seen. There've been a lot. Today's was pretty bad.
What exactly happened today, if you don't mind me asking?
So I was in the ICU overnight on Sunday. Had a young man that was in what we call the IMC, the Intermediate Care Unit. And he had been in the hospital for a while with COVID and, was deteriorating. And I ended up bringing him up to the intensive care unit with the intention of getting him on some sedation to try to help him breathe, to work with him with trying to slow his breathing down, get his oxygenation up. And by 5 o'clock that morning, I had to intubate him. I had to put the breathing tube down, put him on the ventilator. And it broke my heart to do that because at 30 years old, you hope that you don't have to do this. But he was not vaccinated.
Was he, how did he come in to you guys in the beginning,
He was on the medicine service initially, came in with not feeling well, with symptoms of COVID. And so what we do, or what they did down on the floor, was they give him oxygen. And you can give oxygen many different ways, but you can start with what's called a nasal cannula, which is just like a low flow. Mm-hmm. And as someone needs more and more oxygen, then there's different methods, and then you can do what's called high flow, which is still the catheter that goes in the nose, but it really pushes oxygen in very hard. It's uncomfortable, but for some patients that's enough to get their oxygenation up. In his case, he had that, and he had another mask on top of that to try to give him even more oxygen. And when that fails, then the only other thing you can do is called BiPAP or CPAP, which is a big mask which actually forces, under pressure, forces oxygen in. And he couldn't handle that. He was too claustrophobic, and it made him uncomfortable. His grandmother had also died in the hospital, the same place. And so, so for him, this was very scary for him. And so I brought him upstairs. I told him we were going to take good care of him, that I needed him to listen to me. And I even remember saying to him, look at me. I want you to slow your breathing down and calm down. We're going to take good care of you. And for a while, for about 2 hours, I had him calm. I had him on sedation. And then his breathing got worse and worse and worse, to the point where, as his oxygen saturation was going down dangerously low, and he was breathing, normally we breathe at a respiratory rate of 12 to 16 a minute. You don't even think about breathing. He was breathing close to 60. Just, you could see his belly going and just kind of gasping for air. So I knew that it was time. I couldn't help him anymore other than to let his lungs rest. We tire out after a while. You just get tired. You can't breathe that way for a long time. And so put him to sleep, paralyzed him, and then put the breathing tube down. And I spoke to his mom, who was in Florida, and I explained everything that that had gone on. I told her we'll take very good care of him. And I got a call, so that was Monday morning. And when I left, I was physically and emotionally exhausted. I was just exhausted, and I cried. I cried to the nurses. I just cried because I just had a feeling that things were not going to go well. And I got a call this afternoon that the mom wanted to see me because I had also taken care of her mother when her mother was in the ICU with COVID, and her mother died as well. And so that's why I'm dressed the way I'm dressed. I was cleaning my house. I jumped in the car and I went down there, and he passed away. So I was with her.
It's very, tough, like, and especially I feel like with your profession, you come in not thinking all these connections you're gonna have, how it's gonna affect you on a daily, and
So that, yeah, I think a lot of the young deaths have affected me, when you see these young people die. And we've had some successes, but for the most part, once they're out of the ICU, sometimes we hear about them. A lot of times they go to long-term care, they're on a ventilator, or they need lung transplants, or, they die afterwards. So, but the ones that die in the unit, especially the young ones, really, really hit home.
And even with healthy, because earlier you said you are pro-vaccine, obviously.
Absolutely.
Has there been any patients that came in healthy and ended up like fatally? You know what I mean? Like.
Not too many people that have been 100% healthy. They've been I think the biggest risk factor for having bad outcome with COVID is obesity, is being overweight. And I don't know how much Myrick weighs anymore, but he was a big boy.
He's still a pretty big dude.
Yeah. We had, and the young man today was a big boy.
And he had high blood pressure, I think my dad said.
Yeah, he had some medical issues.
Yeah.
But obesity, and it seems to be one of the biggest risk factors. So you might not have, and if you're obese, you probably have like sleep apnea, you might have early stages of diabetes, you might not even know it yet. So being obese really puts a strain on your body, even as a young person. So I can't say that, we've had so many COVID patients that there's been anybody that had absolutely no risk factors that I can think of off the top of my head.
Also, what do you think about the precautions that the hospital takes? Like, do you think that's enough? Do you think you guys could do better?
Precautions, you mean?
The safety protocols?
So our safety protocols are pretty strict. If you have COVID, you're not allowed a visitor in the ICU. No one can come in and see you, which is very, very hard. It's hard on the families, it's hard on the patients, it's hard on the staff. When you're the only person that goes in that room, and that's the only communication, or if they have their phone, once they're ventilated, then the families have to rely on a phone call or set up a Zoom account, and you can Zoom. We have iPads, so they can Zoom into the room, and our nursing staff is very, very good about talking to the families, giving them updates. We call every day and give updates. And as far as the hospital goes, when you come to Mercy, you can't come in without a mask. You have to wear a mask, and you have to have your temperature taken. So not that that's perfect, but that's our way of and even in the ICU, we're supposed to wear masks. I mean, we wear masks all the time. And if it's a COVID patient, then we're in an N95 and a mask on top of that, goggles, gloves, gown. So, we take a lot of precautions.
I've been to, you say Mercy, right? I've been to Bay State, for example, and when I've gotten to, have tested, done, they quickly, if you have symptoms, take you into another set of the hospital. Do you guys do the same?
Yeah, they do the same thing, yeah. So the main entrance of the hospital, it says if you're feeling sick, you cannot come in through this entrance. So you have to go through another entrance if you're feeling sick. And everybody that comes into the emergency room gets tested for COVID. If you're a patient, you get tested for COVID.
What would you say to people out there who are anti-vaxxers and who, don't take it as seriously as they should? What's your message to them?
They're misinformed, and they've placed themselves and their families at risk. So, especially their children that, might not be old enough to be vaccinated yet. Hopefully, we're going to have the vaccine for the 5 to 12-year-olds very soon. And I have 2 granddaughters. You know, I have a 6-year-old granddaughter and a 2-year-old granddaughter. And they live out in Los Angeles. And they go to school and they wear a mask. My 2-year-old granddaughter can wear a mask without any problem. She's not going to be scarred for life. You know, once this is over and we go back to not wearing our masks, I mean, look at China and Japan. Those kids wear masks all the time.
Mm-hmm.
The air quality there is bad, crowded conditions. They're some of the smartest kids in the world. You know, they're not stunted. This is not something that should be a political issue. This is something that is to prevent the spread of a disease that I understand. Most people recover from COVID. Most people get it. They can have a mild case of it. They can have a nasty case of it. The majority of people do recover from it. But it's those people that don't recover from it. It's those people that are immunocompromised. It's those people that, you know, elderly, that may, you know, you as a 25-year-old might feel kind of crappy for a day or two, but your grandmother might die from it. So it's just being a good human being and saying, you know, all right, let me do this for my family, for my grandmother, for my father, for my mother, my children. So get informed, you know, speak to your doctor, speak to your family practitioner. There's really very, very few reasons why people can't get vaccinated. You know, I mean, a lot of people claim religious exemption. There's no religions that I really know of that say you can't get vaccinated. You know, don't just do your research on, you know, news websites. Don't go to Fox News for your new, you know, go look up a reputable, you know, go talk to somebody that's a professional.
Yeah, if you don't mind me jumping in, I think it's sad that sometimes it takes people to see it firsthand to actually start taking it seriously. I know Myrick said that before he got it, he went down with his cousins in Atlanta,
Mm-hmm.
and that's when he got it. And then I think his younger cousin's girlfriend, I think, brought it home, and then
died, yeah.
2 of his cousins like ended up dying
Yeah.
pretty recently.
Yeah.
So
it's you know, you don't want to let fear, you know, rule your life. So if getting a vaccine, I can tell you the day I got my first shot, I cried. I have pictures of me getting my vaccine, and I was sobbing because I thought, if this helps me to stay, you know, doing what I'm doing and prevents me from getting sick, then I was not afraid of getting vaccinated at all, not one bit. My kids are vaccinated. I vaccinated my own son because I was volunteering in the vaccine clinic, and there was 1 dose left at the end of the day, and I said, can I call my son? He was working at the Home Depot, and they said yes, and I brought him down and I vaccinated him. And my daughter goes to school at Union, lives in the dorms. New York State opened vaccines, you know, it was easy to get vaccinated there if you lived in congregate housing. So I got her in right away and she got vaccinated.
And then my last question to you would be, what do you think, because, you know, like you said, it's a lot of misinformation out there, and ignorance is bliss, I feel it, you know. What do you think, like, do you think it was, just to put that information out there, the vaccines, do you think it was enough testing going on? Because, you know, obviously it's been over a year
Right
now, and people are scared, like, you know,
So,
they're just throwing that out there.
So mRNA vaccines are not new. The technology has been developed. We've had this technology for a long time now. And the fact that we've had this technology was what enabled us to get this vaccine rolled out so quickly. I actually even volunteered to be a part of the trial. Unfortunately, I never got called, but I was willing to you know, give myself to science and say, you know, vaccinate me. I'm more than happy to do it. So people seem to think that, you know, they're injecting virus into you. They are not. That it's experimental. It's not experimental anymore. The Pfizer vaccine and the Moderna have been fully FDA approved. And I believe that Johnson & Johnson is FDA approved now too. What they don't understand, these people that don't want to get vaccinated, is if they do get it and they come in and they're really sick, they're going to get medication that is not FDA approved for treatment of COVID. The monoclonal antibody that we're giving now is for emergency use authorization, much like the vaccine was before. So, you know, when you see these people who didn't want to get vaccinated and come in and say, save my life, help me, they're willing to take any and all treatment. They're not questioning, they're not saying, well, what's in this that you're giving me? They don't care. They don't care. It's like, I don't want to die. So, you know, if it was just as simple as getting a shot, you know, you might feel crappy for a couple of hours after the shot, but knowing that, you know, you've got pretty good protection. And yes, there's breakthrough cases. We're seeing breakthrough cases, but the majority of people with breakthrough cases are not coming to the intensive care unit. They may come to the hospital, but they're not getting so sick that they're having to be intubated. I think we've had 2 and they had a lot of medical problems to begin with. They weren't healthy people that got vaccinated and then got COVID and were so sick they were in the ICU. These are people that were vaccinated because they had a lot of underlying medical problems and they got sick. So, and we're starting to see it in, you know, college campuses, which is why my daughter goes to Union College and they're tested now once a week. They weren't going to do it, but they started seeing some cases pop up, so now they're tested once a week. If you're contact traced, such as my daughter was on Friday, she was with somebody that tested positive for COVID, but because she's fully vaccinated, she didn't have to quarantine. She could still go to her classes, but she has to wear a mask. In Union, they have to wear a mask. They don't have to wear them in the dorms, but in the classrooms, they have to wear them. You know, and that's the rules. I mean, nobody's fighting it, and you know, it's like you want to be on campus, you want to have a normal academic year, you want to have your friends and your social life and everything, wear a mask. And Union required that all students be vaccinated, unless you had, you know, some special exemption. And if people would just do that, I think we could get the majority of this virus under control. It's never going to go away. It's with us now for forever. It's going to be like the flu. At least that's what I think. It's going to be like the flu. And once a year, you're going to have to go get your vaccine so that you don't get it. And that's okay. That's okay. I go for a flu shot every year, you know, and I think unless you're medically compromised that you can't get a flu shot, you know, a lot of people die from the flu. A lot of people die from the measles. A lot of people died from smallpox. And we pretty much eradicated it with vaccines. So it's unfortunate, but I think this has become a political issue rather than a humanitarian issue. Nobody's going to tell me, the government's not going to tell me, and I don't think that's going to change anytime soon.
And I can agree with that, the political issue, yeah. I feel like it's just, oh, what are they doing this time, and, you know,
Yeah.
things like that.
Yeah, the microchips.
Yeah.
I actually had a patient that told me that